If you thought South Africa was out of the COVID-19 woods, well, think again. The country's first case of a coronavirus infection caused by the subvariant of a highly transmissible XBB.1.5 has been recorded. The variant was discovered in gene sequencing carried out by researchers at Stellenbosch University in the Western Cape. It's been nicknamed the Kraken variant for its ability to spread quickly. Our reporter Silindelo Masikane is on that story and is joining us now for the latest and update. Silindelo, good afternoon. So what can you tell us? What do the scientists actually know now about this new subvariant?
Well, I can tell you, Bradan, that in fact we went to Stellenbosch University this morning to the Tygerberg Medical Campus, which is where the lab is based, that received the sample, the December 27 sample that picked up that there is a new Omicron subvariant. And this morning, in fact, they got new samples from various labs across the country for more testing, more genome testing to see whether in fact there's been an increase in the number of infections from this new subvariant. Now, what we know at this point is that it's been dubbed the most highly transmissible subvariant of the pandemic so far. The symptoms are similar to those of the Omicron variant, because it is a subvariant of the Omicron version of COVID-19. And at this point, from what we understand from the scientists, they're saying that there is no need to panic so far. There is only, of course, like you said, one case that's been picked up in South Africa thus far. But at this point, genome testing is taking place at all 9 labs across the country to see whether there is an increase in infections in terms of this particular subvariant. Let's just take a listen to what one of the scientists had to say with regards to the concerns about this new subvariant.
South Africa has one of the most advanced genomics program in the world. And if we detect viruses, variants, or different pathogens early, we can prepare to respond. And I think that was one of the reasons why the rest of the world in the last year had a lot of deaths and had restrictions, and South Africa had not, because we can identify very early, we can communicate very early, and if the need arises, we can make sure that our hospitals are prepared to that, which again, I do not believe that we have any reason to be nervous or to be panic. I think that South Africa is very unlikely to have another big wave of infection.
You know, when you hear about a new variant or subvariant rather, Silindelo, you wonder how far are we in terms of declaring an end to this coronavirus pandemic? What are you hearing?
Well, it doesn't seem like we're much closer, but what we do know, Bradan, is that it does seem as though we are out of the woods in terms of those very dire cases where people were actually dying from infection. At this point, we know that there have not been any increases in hospitalizations so far, but what we know is that we are in what scientists are calling the second phase of the pandemic, where the symptoms are not as severe, but how far we are from declaring an end to the pandemic still remains to be seen. But at this point, it does seem as though health professionals are monitoring the situation quite closely, but that, you know, there is messaging around the fact that we should not be panicked about it, but that South Africans are really, in essence, being urged to vaccinate if they haven't been vaccinated, to get their boosters, in particular those with underlying conditions, those who are much elderly. You know, they are being encouraged to actually get their booster shots, and if you haven't been vaccinated, we are, you know, scientists as well as health professionals are asking South Africans to do that, even though at this point, Bradan, we know that the country is in a stage where population or herd immunity has actually been reached. Let's take a listen.
The pandemic basic has two big phases. Yeah, the first phase was that terrible phase that many people die with restriction. I really believe that that phase it is over, and now what we're moving to a phase that the virus continues to circulate but do not cause havoc in the country. I believe that's the phase that we are, and I believe that we're going to continue in that phase. And that's why this kind of work is so important, because we want to make sure that we know what is circulating, so if something comes that could cause problems, we can have the countermeasures, which have been very efficient in the last year in South Africa, and I believe that continuously will.
And then what can we expect to happen in terms of government interventions?
This is what we're actually expecting to hear sometime this week, Bradan. We know that the health minister will be meeting with the eNCA, that's the National Coronavirus Command Council. Engagements are taking place, of course, with the researchers and scientists who identified this new subvariant. And at this point, we also understand that in terms of the Western Cape Health Department itself, they're also monitoring the situation quite closely. And of course, Bradan, this kind of subvariants that have been picked up, this kind of testing has been taking place for 2 years now, since the beginning of the pandemic. Every week, samples have been tested since as far back as March 2020, which is why South Africa has been able to pick up the number of variants so quickly, because these tests have been done on a weekly basis. But I know South Africans are concerned around the possibility of lockdown restrictions making a return. But at this point, speaking to some of the health professionals, such as the South African Medical Association, they're saying that any kind of lockdown at this point would be futile, and that in fact what should be happening is that South Africans should just be vaccinating and observing those non-pharmaceutical interventions. But let's just take a listen to the Director of Operations at the Western Cape Health Department with regards to what they're doing in terms of monitoring this subvariant.
Western Cape Department of Health and Wellness will be monitoring the emergence of the new variant XBB 1.5 very closely. Thus far, we have not detected any increase in cases, hospitalizations, or deaths. We encourage the public to get vaccinated and for those eligible to get their booster doses.